Hi, I'm Dr. Roy and I'm going to explain why we take dental x-rays, what they mean, what we look for, and how they can help you. Now, can you see the three layers of the tooth? On this outer layer, we've got the enamel, the protective layer of the tooth. Inside here, this grayer layer here is called the dentin. It's 6 times softer. And then finally, the dark area inside is the nerve. So this dark shadow here is what we call interproximal decay. And essentially, a lot of people can have it if they do not floss in between teeth. And the problem here is that if you're not flossing daily and dislodging the trapped piece of food that goes between teeth, this dark area on an x-ray can just get bigger with time. So the idea is you need to dislodge that trapped piece of food, or your gums are just going to get inflamed, they'll bleed, and this is where decay and gum issues happen. So a few tips about flossing. One, you could either use a interdental TB, which helps go in between the gaps of teeth, or using floss, a tape. The idea is index fingers alone. Do this, it's not going anywhere. Thumbs lie in the middle, and the closer your thumbs are to your tooth, the better the control you get. So with this hand, if I'm cleaning this side, I would move the cheek out the way, and again, closer thumbs are to the tooth you're cleaning, the better the control you get. So you let it just go into the gap and straight back out. And you just go around each tooth, and then as you get to the midline, switch hands. This hand goes on the inside of the roof of your mouth, and this one goes on the outside, moving the cheek out the way. Now for the lower teeth, only difference is rather than using your index fingers, use your thumbs. Sorry, reverse that. Instead of using your thumbs, use your middle fingers. And that way you can reach all the areas on the lower. Same principle applies. So what I'd recommend, if it's been a while since you've last had a checkup, get an exam. It's not as expensive as you might think, and it will give you a lot of information right away, just to make sure if you're dentally fit and there's no issues to worry about. But if there is these areas of decay, this is where fillings are needed, or just good flossing technique. It may not be as bad as you think. So book it.